Hi there, it's Dr. Jarrod Frank again here at PFRANKMD, and today's video blog we're going to be talking about pigmentation, particularly melasma. And it is melasma season. It's September here in New York. We all had a great summer, and no matter how much people try, particularly women, to keep their melasma under control, the heat, the sunlight, it just brings it back. We don't know exactly what causes it, but we certainly know it's a hormonally induced type of problem. It's mostly common in women, and it's a very frustrating condition. Since the 80s, we've been using chemical peels and retin-A type products and hydroquinone and other lightening agents to control this condition. And we do have effective treatments, but the problem is it does keep coming back. So we do have some new ways to remove it, ones that are appropriate for several skin types. There is no best laser, but it's often the combination of various things done by a skilled healthcare practitioner that's going to really give each person the best result. There are some new topical therapies and some oral therapies that we're using for melasma now. But the first thing I wanted to talk about is our PFRANKMD signature procedure called the Pigment Protocol. And this is really a combination of two very common devices now that are cutting edge that work very, very well for pigment. The first is a very common fractional type laser in what's called the clear and brilliant Permia category. This is an exfoliant treatment. It really works at the epidermis, and that's where a lot of people with fairer skin tend to have melasma in the top layers of the skin. This tends to be the melasma that's easier to treat. The more difficult melasma to treat, and a lot of patients have a little bit in both areas, is the deep melasma, what we call dermal melasma. And you could use a black light, like one of those black lights you used in high school that make everything white, kind of glow. And you could use that type of light to determine approximately at what level of the skin it is. So every patient with melasma should be evaluated with this simple device to help determine the best treatment. But for that dermal melasma, this is a more difficult area to treat pigment. And we tend to use a different type of technology. And actually what we're using now are technologies that were traditionally great for tattoo pigment. And there have been some advances in these type of pigment lasers, what we call Pico Lasers now. And the type of laser we're using for dermal pigmentation of any kind, whether it's melasma or pigment in scars or people who've had complications with lasers or traumas, the type of technology I use is called Pico Genesis. And it's a simple light treatment that takes 2-3 minutes to do. It actually only has about a couple of hours of redness, and the recovery is quite simple. But what makes the Pico Genesis magic, and what we found here at PFRANKMD, is its combination, its synergistic response with other technologies that will work more superficially. So what we do here is we combine the Pico Genesis with the clear and brilliant Permia, which is a very light Fraxel type of treatment. And we use the right setting for the right patient. And again here, all people are not created equal based on their skin color, unfortunately. Darker skin types are certainly much more difficult to treat. We have to use certain settings and certain protocols that are appropriate for them compared to lighter skin patients. But the key thing is we have two great technologies. We can treat all levels of the skin, and in the right hands, here at PFRANKMD, we could find the pigment protocol that is right for you. We do expect results in as little as one treatment, and depending on your severity and your level of tolerance, we make a skincare protocol that's right for you. So that's one way to treat the condition. The real issue is how do we teach you to control it? And there are several topical and oral therapies now that are new. One of the more popular ones is called tranexamic acid. We can use that both orally and topically. If you're the right candidate, it's really been a game changer for the treatment of melasma. And once again, it's about bringing a patient in, examining the condition, its severity, one's skin type, response to therapy, and finding the right combination of things that are right for you. Because it's not just about treating it, it's about keeping it away and giving you the skin that you deserve. And we do that here at PFRANKMD. So hopefully we will see you soon. And to find out more information about all of our signature procedures, you can come visit us at pfrankmd.com. See you later, guys.